I'm so excited to be here, and Morgan is actually my therapist. So we're excited. This is going to be kind of I guess, a podcast interview with Morgan, as she's going to share kind of her experiences working with individuals with chronic illnesses. And then I'll share a little bit about my story as well of how I've dealt with my mental health and my chronic illness. So we're really excited to be with you guys today. Throughout the session, since I am just kind of going to be mediating conversation with Morgan, and her and I are going to be touching on a lot of different topics, I'd love any questions that you have, just go ahead and send them in a private chat to me, and I'll try to facilitate those as they maybe come up in our conversation. And then we'll also maybe leave a couple minutes if we have time at the end to have more of an open Q&A session. So let's get started. Let me give a little introduction to Morgan. So her background, she was born and raised in Utah and traveled to Colorado to extend her degree. And she spent 8 years there working primarily as a medical social worker. So she was working with a lot of patients with acute and chronic illnesses and life transitions. And now she is currently running a clinic in Utah called Therapy Transformed, with a lot of amazing focuses. And I know they're doing a lot of great things at their clinic. So I'm really excited to be speaking with her today. And kind of the first topic that we're going to talk about today is how to find a good therapist, and specifically a therapist that is the right fit. And so Morgan, I know that I'm going to go over and talk about some resources of how to actually find the therapist, but I'd love for you to talk about those interview questions that you mentioned, of what to do when you find that therapist.
Yeah. Well, first of all, thank you so much for having me. I'm really excited to be working and speaking with all of you. This is a new demographic for me. Like Haley mentioned, I do have, I primarily am a medical social work. So I spent about 9 years in hospital settings, kind of going in between inpatient and clinic settings. And so I've worked with quite a few different variances of chronic and terminal illnesses. I primarily focused on oncology care, but what comes with being a medical social worker is that you spend a lot of time working with individuals who come back and forth to the hospital with kind of chronic and long-term illnesses. So I'm really excited to be here. So thank you for having me first and foremost. And when I moved back to Utah and really started doing private practice, one of the things that I think about when I'm looking at even my profile as a therapist is, when Haley found me, one of the things that she was really looking for was specifically that I have a medical background. So, as a therapist, I think anybody who is working with any type of mental health should be looking for a therapist who has some somatic experiences or some medical experience in the background. And why I think this is so important is because our mind and bodies are so connected. It's something that I really value in my practice. And it's something that I think individuals living with kind of some chronic or long term illnesses really deserve to have a therapist who has some verbiage in it. Right. So I am not an expert in arthritis by any means, but I do really work with the mind body connection. And so I think that that would probably be the very biggest piece in finding a therapist is really looking for someone who incorporates that somatic, holistic, alternative approach to mental health therapy. As therapists, we're really trying to kind of move away from this traditional practice of like, we just sit on the couch and we talk about your feelings. We're really looking at kind of this alternative look at how does your body and your mind kind of communicate. And if your body is sick, your mind doesn't feel well, or vice versa. If your mind is sad, your body doesn't feel great. So that is, I think, probably the highlight that I've seen on Psychology Today, and really with my profile and even other therapists that I work with. We really try to highlight that that is part of our work that we will do with you is really encouraging mind-body connection, whether with mindfulness, meditation, exercise, nutrition, well-being. And there's also a huge shove in the mental health field for all therapists to be really engaged with that mind-body connection. But I think just really finding someone who has some medical background or some knowledge, but even a therapist who's interested in saying, I don't know, can you teach me? That is one thing that Haley and I have talked a lot about is that I will say, I don't know, you're the expert in your body. tell me what's going on with your body because you're the expert in it. So does that help with that first question of like, how do you
Yeah.
find a good therapist?
Yeah, no, that's really great, Morgan. And I think I agree with you in the fact that, I mean, I've really appreciated your expertise, and I feel like I've had a really great experience just openly communicating and sharing with you things that, and you've been like, tell me a little bit more about that so that I can better understand. And so a couple different ways. We also have included a resource list. If you go to where the breakout session is held or this session is held, there is a resource list where there's a couple different websites that you can actually go in and type in like chronic illness therapist. And so I would encourage you, anybody who's looking for a therapist, do your research. You can even type in Google. In fact, I have a little highlight on my Instagram story. My Instagram is at Arthritis in Motion, and I have a little highlight that walks you through using Psychology Today, how to find a therapist that specializes in working with people or has experience in working with people with chronic conditions. And so you can read the bios and you'll be able to really tell where that therapist is. And I think with Morgan's background, it's been really helpful, and I've seen a lot of great benefits. Actually, the way that I found Morgan, I asked one of my friends who also has arthritis, and she was working with Morgan and had a really great experience. So another way that you can find a really awesome therapist is ask people that you trust. And I think you'd be surprised how many people are probably actually meeting with a therapist or who have found a good therapist that they work with. So Morgan, now I kind of want to talk about, you kind of brought this up about this mind body connection. Let's talk about, why is mental health so important when dealing with a chronic illness?
Yeah, good question. So, my primary focus of work has been around our minds and our body. It's something that I am very passionate about. We have tons of years of research that shows that mind and body are so connected, and actually, our second brain lives in our gut. So, people who have inflammation, autoimmune, arthritis, other chronic illnesses like that, they actually have a 30% more prevalence of having depression or suicide ideation, because inflammation and chronic inflammation in our body can actually change our brain chemistry. So when I look at mind body connection, a lot of people will think like, oh, well, I just need to do yoga, or I need to care for myself, or I need to work out more. That's actually not what we're talking about in the mental health field. What we're talking about is that your body actually, because of the inflammation, because of a chronic illness, because of a kind of a physical stressor, has a brain chemistry change in your brain. So all of a sudden, our physical well-being has now created a change in our brain chemistry. And when that happens, it's not just because I'm depressed, or it's not just because I'm anxious. It's actually because my body, something's going on that's making me more depressed or more anxious, or I people are sometimes more prone to, Morgan, why can't I manage my anxiety like everybody else can? Well, you can't, because your body is inflamed, right? Like, we know that your body is really sick also. And so that's where, when we look at mind body connection, we really look at the data, and we really look at like how much it can impact us. As everyone can, probably can attest to this here, is that when your body feels like crap, when you are stressed, when you wake up and you're like fatigued physically, or say you've had surgery, or say you've had a huge, flare up of your arthritis, your mood isn't great. It's not like you jump out of bed and you're like, I feel like $1,000,000, but my joints literally I can't move, right? Like, that doesn't exist anymore. And so, like, as the mental health community, 50 years ago, we were like, oh, we'll just give you a medication and your brain will feel better and then you'll feel better. What we're finding is that that was absolutely wrong. We have research now around the polyvagal theory, is actually what it's called. Really interesting to look it up. Polyvagal theory, and then also chronic inflammation and chronic depression. We are finding, like I said, 30%, because our second brain lives in our gut, that if we carry a lot of inflammation, if we carry a lot of, physical illness, that it actually sends signals up our brain stem into our brain, and it tells our brain, hey, I don't feel good. And then serotonin stops making. So serotonin is the indicator for, it's like our feel good. So serotonin in our body, in our brain, it starts making it, and then our receptors open up. Serotonin jumps into those receptors and goes down into our body, and it makes us feel good, our body feel good, but then it also stimulates it so we don't have depression. What happens is that when you have chronic inflammation, or when you're really like physically sick, your brain isn't like kind of like clicking to make serotonin. It's not like, hey, make more serotonin. It's like, hey, I don't feel good. I'm not going to make anything. I want to sleep, or I don't want to do anything. What we're looking at now is that to stimulate serotonin uptake is that mind body connection of how are you using mindfulness and meditation? How are you staying grounded, using breath work? How are you physically taking care of yourself? And a lot of the time for me, it's not about adding more or taking away. It's more just about being intentional around our care and our mind body connection of when I'm tired, rest, listen to your body, right? Like when your joints are inflamed, don't go for a 10-mile run. But when you don't feel good, it's okay to have a moment of rest and relaxation and repair, because that's actually what our brain needs. And then it's also okay to do very kind things to our body. So that's really what we're talking about when we talk about mind body connection, is that it's not just about working out and having a healthy diet. Those are parts of it, but it's actually about listening to your body and your brain. Does that help?
Yeah. Wow. Is anybody else's like mind blown? I'm like, what? You just explained everything, and that is so cool. I love that. And I think the biggest thing that has helped me, not only understanding all this, but understanding like, oh, right, when I am like not feeling good, or when I'm in a flare, I also need to be intentional about taking care of my mind. And I think Morgan's really helped me develop certain coping strategies, because something that we talk about a lot, and I think that everybody here should know, is like, you are the expert in you. Morgan already said that, but you are the expert in you. And so the things that you're going through, how your body reacts to things, you really are your own expert. And so I think it's important as well to learn how for yourself to be more kind and more gentle. Like for me personally, I'm working in a pretty high demand job. I'm running a startup, and it's a lot. It is a lot. And I have found for myself, I often look around and I compare myself to all these other entrepreneurs, or all these other business owners. And, they have their foot on the gas, like full fledged, going full speed ahead, working 20 hours a day, and just killing themselves. Right. And I physically cannot do that. I have noticed that if I work longer than like 6 or 8 hours in a day on my startup, I immediately the next day I'm like feeling it. Like I wake up so fatigued, and I don't regulate my stress well. And so, I can look at these other entrepreneurs and I can see that they're working their heads off, or they're working like crazy. But for me personally, managing my chronic illness and my mental health is what is crucial for me to actually be the best me that I can be. And so I think that's important in just managing your mental health and your expectations of self. With your chronic illness, is you have to learn what works for you. You can't look around at other people and say, oh, this person's doing this with their life and this person's doing this with their life. You have to know that wherever you are in life, like you're worthy of all the great experiences in life. And you don't have to do more or be more to just be you and to have value. And I think that's been like a huge wave that I'm striving to learn, and that Morgan has really helped me discover for myself in managing my own mental health as well as my chronic illness, that like I have value. I don't have to do more or be more to have greater value. And so I think that's really important. And Morgan, I don't know if you have anything to add to that.
Always.
Please.
Always. Well, I just love that you mentioned that, Haley, because I think that that is in working with the field that I have with illness, and I've explained this to you also, is like any type of chronic or terminal illness feels out of control. right? Like you literally have something going on with your body that you can't fix, and you put all of your trust in the medical community and doctors and things like that, and then you have kind of this big huge medical trauma, right? Like, and it feels really out of control and disempowering. And so when we look at being the experts in ourselves and in our bodies, it's really a way to empower ourselves around having a voice around, we are the experts in our body. I know when something's wrong. I know something's not right. But then on top of that, it gives us a sense of control when we're in an out of control situation. And I think that empowerment alone is really where everyone needs to have it. But especially if you have a chronic illness in this area with arthritis, and that like that kind of constant, I'm in pain or something's wrong with my body or my body doesn't feel right. I think that Western medicine has, we can look at it as like this picture of Western medicine where they're like, this is what I can do to help all of your symptoms, but best of luck, right? Like the doctor doesn't live with this, you live with this. And so I love that you brought that up of like, you have innate worth, but also you're the expert in your body. And that's why I think mental health is so important when you do have a chronic illness, is because you deserve to feel empowered and have a sense of control around a very out of control journey for the rest of your life.
Yeah, I really like that. And something that just came to my mind as you were talking about that, I think another thing that I think has been crucial to my journey, I've noticed, is I find that often I'm kind of like,
It's 11:30.
Sorry, that's my laptop. It speaks to me every 30 minutes. That's embarrassing. Anyways, I feel like for me, I often get in this like perfectionist mentality and think like I have to do everything in my power to avoid a flare, or to make sure that really it's all around like avoiding a flare. So I try to do things with like making sure I get enough sleep at night, following a good diet, exercise, of course, things like that. But often that like stress is what actually makes a flare come up. And so I think that anytime I experience a flare, for me, I feel this like intense frustration and anger, because it brings me back to feeling like I have no control over this, or I should have done something to control this. And like I just get in this thought spiral, and then it brings me back to, I hate that I have this. I hate that this will never go away. And I hate that I will always live with this for the rest of my life. And Morgan has really helped me approach that side. And it's still, and I think what's important is like, those are feelings that I still feel all the time, especially when I've had a couple of months where I've been feeling actually pretty good. And then I have like a week where I am just like in bed all day. It's hard to get up in the morning. I have no motivation to do anything. And I just like feel those same intense emotions over and over again. And I think what's important when you, and I'm sure a lot of you can relate to maybe emotions that you feel when you are in a flare, whether you feel depressed or you feel anxious or whatever it may be. I think it's important to honor those emotions, recognize that they're there, and then let them like move through you. Because for me, I find like I get frustrated, so I just try and suppress like every negative emotion that I feel, and I think I'm fine, like, and I just try and shake it off. But I think it's important, it's okay to sit in those emotions. And so Morgan, let's talk about that. Let's talk about acceptance. Let's talk about, because I know that people here, we have, in fact, I would love if everybody put in the chat, I'd love to hear, how long have you lived with this? I know we have some people who were diagnosed when they were really little, like 6 months old, some when they were teenagers, and some maybe who were just newly diagnosed recently. So yeah, put in the chat, how long. Carrie, 25 years, holy cow, diagnosed at 2 years old. So as these chats are coming in, Morgan, I'd love for you to speak kind of around this area of acceptance.
Yeah.
Because like I said, like for me, I was diagnosed when I was 15. So I had a period of my life where I was normal, so to speak. And then it was like, boom, oh, I have this life-changing diagnosis. And then you have people who, I think it looks like majority so far, who have lived with it their whole life. Like they've never really known anything different.
Yeah. Yeah, that's a hard one, right? Like this is something that I think is hard to accept, anything that really kind of debilitates you in your life. And truly with arthritis, this is such a huge debilitating. We look at it as like sometimes it's the Haley, what is the word that we always use where it's the invisible diagnosis, right?
Yeah.
Where someone would see Haley and be like, she's fine. What is she talking about? And Haley's like, my joints are literally on fire. I can barely breathe today. So it's this is such a hard one because I think also there is not a stigma around it, but it's definitely different working with like cancer. Like you're like, oh, I have cancer. Someone's like, oh my gosh, you have cancer, right? When you say, oh, I have arthritis, that's not the response normally that happens, right? So then it even makes it harder because there's a social stigma, but then you have your own kind of perfectionism that Haley talked about, or your own kind of ideals of like, I should be able to do this, or I'm young, I shouldn't have issues with my joints walking around Disneyland like everybody else can do it and I can't. And I think that that is very validating to hear that like your emotions are valid. This is what you are dealing with. It can be so overwhelming and so stressful, and it is invisible at times. And it does feel very social stigmatizing and kind of like just like at the wayside. And so, with acceptance, how Haley and I have really looked at it is that what can you feel empowered around with this? Like, what can you actively do not to beat yourself up around having a flare or not to like kind of like drive yourself into the ground? But what can you do to say, like, hey, like, this is my story. This is my journey. This is part of who I am. Yes, it defies me sometimes. Yes, it kind of knocks me down sometimes. But it actually I don't believe in this statement like things happen for a reason. I actually dislike that statement. What I believe in is that things happen in life and then we have to process and make meaning of them. That's just reality. So how do we make meaning of the journey of being, having arthritis or having a chronic or terminal illness? How do we make meaning of this in our lives daily? And sometimes in our lives daily, it just sucks and it's terrible and we hate it. And other days it empowers us and it keeps us in a community like this, or it keeps us connected to other people, or it gives us empathy. And I think that that's the biggest piece around acceptance is that you are okay with who you are. There are hard days and there are good days, but also you're in the process of this journey of life trying to make meaning of it. And that's the best you can do because you're just a human being, right? Like we're all just imperfect human beings. And that's what I look at around acceptance. It's another thing that we kind of talk about is when a flare happens, you are strong enough to get through it also. That was one of the big things that I have learned in my journey of working with individuals with arthritis is that those flares are scary and they're big and it's kind of always kind of waiting for the next one. And that fear base can actually spiral us more into a flare because stress and anxiety and inflammation put us into a flare, right? Like we know that medically, mind body connection. And so, one of the things with this is really looking at yes, I will have another flare. That's what I can accept is that I can accept that I will have another flare and it's going to be overwhelming and it's going to be hard, but I also can make it through because I've been doing this my entire life. Like I know how to take care of myself. I know how to process and get through this. And I think that that's a really big deal when we start to kind of accept ourselves and we can know that we are strong enough to get through these things and we're making meaning and processing them. And that is what kind of keeps us propelling and going. And it does look like in the chat, most everybody has lived with this diagnosis most of their lives. And so that acceptance piece, I think, can be changed around of like, just accept it. This is who it is. It's not that big of a deal. That's not what the acceptance we're talking about. We're talking about that empowered sense of self of like, I can make meaning of this and I can decide how this impacts me some days. And other days it kind of crushes me and I'm just going to let myself have that day.
Yeah. Yeah, I love that. And I like that you kind of brought up something where like just making meaning of your diagnosis. I think that's something that's really helped me. I don't want to get like into toxic positivity or anything, but I like kind of reflecting on the question of like, what would I not have or who would I not be if I did not have this illness?
Yep.
And I've realized that this illness has helped me be more in tune with my body. When I think, there's a big hustle culture in this world, and a lot of people will work themselves to death to then finally it will hit them and it will really have an effect on their body. And I've noticed I can't do that. Like I have to manage my energy and my body like every single day. I can't just burn myself out and be okay with it. Um, And also, I just think it's helped me be more empathetic. I have friends that come to me all the time who either have a chronic illness, or I have friends who are pregnant and going through like nausea and crazy things. And they're like, Haley, how do you deal with like just stuff? And it's been an opportunity where I've been able to help a lot of other people. And I feel like it's definitely made me who I am today. And I'm really grateful for it in that aspect. Again, not trying to be like in this toxic positivity, but I truly am grateful for the experiences that arthritis is giving me. And I think that when you do feel down, I think it would be helpful to maybe ponder that question of how has arthritis made you who you are? And I think that that's a really good question to ponder. And Morgan, I kind of want to talk about you kind of were talking about this topic, but around this like uncertainty, that's something that I often struggle with. And there have definitely been times where I'm like, okay, how bad is this going to get? Because there have been times in my life where, when I was first diagnosed, I feel like my symptoms were pretty manageable. But then once I was actually like in college and I was newly married, I had the worst flare of my life, and I was experiencing symptoms that I'd never experienced before, like a lot of depression, a lot of brain fog. So I couldn't even like sit in class. And it was probably the worst flare I've ever been in. And so I think that's definitely really hard. And it's still something that I struggle with, like thinking about the future, thinking about goals that I have, thinking about maybe starting a family, of like, how bad is this going to get? And there's a lot of anxiety and uncertainty around that. So how do you manage that?
Yeah, great question. I would first like to start with though, has anybody else heard the term medical trauma? Any, like, raise your hand or throw it in the chat. Okay. Okay. Anybody else talk to their doctor about medical trauma or a therapist about medical trauma?
And the
Yeah.
hands go down.
Hands go down. So this is something that as a mental health community, we are actually looking at, we've always just thought trauma was those three big ones, right? Like physical, sexual, and emotional. We've always just kind of calculated like, oh, this is just trauma, or like, oh, if you're a vet, you have PTSD, or like trauma has really been put in containers and kind of labeled for certain groups. It's actually something that I work a significant amount with is medical trauma. And the reason why I bring this up around this uncertainty is because the body keeps the score, right? So if I have a major medical trauma at any time in my life, that automatically breeds uncertainty, right? So trauma is anything that sticks with us as a loss of control, or that like naturally we all have an ego defense mechanism. We all have kind of like this built-in way to address things that are crisis, right? What happens is that when a crisis happens or something traumatic happens, when our body or we can't react to it in a way that we would to protect ourselves, that's what creates trauma, and that's what creates medical trauma, right? So if I am like happy, healthy, like living my life, and then one day it's like completely changed, and I don't have like my instincts can't come in and like fix my body or get me out of this trauma, that breeds uncertainty, and it breeds actually a sense of not feeling safe within yourself, within your body, with like knowing yourself, having safety within like your own choices. Being diagnosed at a young age with a chronic illness, this is actually what we're seeing is we actually see PTSD in most of our clients who have chronic illnesses that were diagnosed at a very young age, because it's kind of a consistent trauma on top of a trauma, and that just breeds uncertainty. And then you have this entire traumatic piece where trauma continues to be relived even if you're not in the traumatic situation, right? So you have a flare, and it's not just a flare. It's not just my joints are upset or I'm stressed out or I'm overwhelmed. It's I'm being re-triggered through trauma. I'm having a re-traumatization every time I have a flare. And then as you get older and your body changes, as we know, because all of our bodies change as we get older, that uncertainty grows and that trauma can be impacted actually more and more and more. And then all of a sudden you're reacting kind of in a trauma frame all the time. And all, even if you're not even in a flare, you're kind of on trauma hypervigilance, is what we would call it. And so, in that uncertainty, that's why working with a provider, but also working with medical trauma and talking with someone about medical trauma is really important. It's the work that Haley and I do a lot together of like, when the flare comes, how do you recognize that this isn't just a flare? It's actually a trauma trigger. And how do you move through and process through it? And then that uncertainty is based in fear, right? So it's fearful. It's fearful to have trauma, and it's fearful to be like, I don't know what's going to happen with my body. And what does it look like if I have kids and I end up in a wheelchair because my joints can't handle this, or because my arthritis flares and I'm unable to take care of myself or my children? That is all kind of a trauma based response to something that has already happened. And I saw someone in the chat that makes so much more sense. Yeah, we don't talk about this stuff. We haven't been talking about it as a mental health community. And that's why I'm so passionate about the work I do, but also was so passionate about coming and talking when Haley asked me to, is because this is actually more of trauma than it is just like, oh, be careful, you've got stress and now you have arthritis. And so that is one of the things with uncertainty. And we also talk about, none of us know what's going to happen in the future at all. And so anxiety pushes us into the future, depression keeps us into the past. We just try to stay grounded and present in the here and now. We can live in the uncertainty of fear, or we can look at it as like Haley said, like, how can I make meaning of this today? Like, today's a hard day and it sucks and it's overwhelming, but instead of living in the uncertainty of the future, how can I kind of just stay here with where I'm at and kind of honor and create space around my body? And yeah, in the future this isn't going to look like this. And so I think it's also this piece too, and they really hold hands. Fear and trauma hold a lot of hands, and so it's about working through that too.
Yeah, that's so cool. So go ahead and send me, you guys. I'm going to share a little bit about my experience working through some things that Morgan was able to help me uncover around like my medical trauma. And so go ahead and start sending questions if you have any, because then we'll kind of just jump into Q&A. If you want them to be held confidential, you can send them to me or Carrie. If you don't care to just put it out in the open, you can just send it as an open chat, whatever you feel most comfortable with. But for me personally, someone asked, can you talk more on the trauma triggers that could have taken place? So for me, what I noticed, so before I was diagnosed at the age of 15, I know for a fact that I had it long before that. But I grew up in a family that was very like, tough it up, you're fine, like just keep moving, like don't be dramatic. And so growing up, I was viewed as like this very dramatic child when really I just had a chronic illness that I wasn't addressing. And so as I got into my teen years before my diagnosis, anytime I was like in gym and my wrist was hurting as I was doing push-ups, I would say to myself like, oh, Haley, you're such a baby, like just suck it up, you're fine. And that's kind of how I treated myself. And I wouldn't talk to my parents about my pain. It took my hand being the size of a baseball to finally go and get something checked out, which led to my diagnosis. And so something that I find, that's why, I brought up how I get these feelings of frustration, because that's often what I've realized, how I sometimes treat myself when I'm in pain or when I'm coming up on a flare. I think like, oh, just suck it up, you're fine. And I push through it. And I'm really good at that because that's what I did all growing up. And then when I was finally diagnosed, it was like a slap in the face of like, okay, like I actually do have this chronic illness. And so I've been to a therapist before that, and we just uncovered like some things around the day of my diagnosis, but Morgan was able to help me actually uncover the root of a lot of my medical trauma that I was undiagnosed for years and unvalidated for years. And I just thought I was being a baby. I just thought I was really dramatic. And that has been so eye-opening for me and has helped me extend a lot more compassion to myself, and has helped me realize that I'm strong. Like, holy cow, like I lived that way for so long. And so I would highly, if you feel like Yeah, if you want to have that conversation of medical trauma, I would highly encourage you to find a good therapist to work through that with, um, because that has been a huge part of my mental health journey. Okay, so let's go ahead and Morgan, I don't know if you want to add anything around the
No,
question
no,
of,
that was really great. Thank you for sharing.
okay, so let's see. Okay, so this is a good question. Um, Morgan, what tips do you have for preparing mentally for going to like a new doctor, new specialist when you have been dismissed in the past or told you're faking it?
Yeah, biggest pet peeve of mine is being told that, like, yeah, you don't know your body, right? And so I think that the biggest tips that I have is empower yourself. You are the expert in you. When I look at medical professionals and what I've like learned over working with doctors and stuff is that doctors who look at a holistic approach are more integrative, which is kind of a new kind of hopefully forefront that's coming up with doctors of a new generation, is that they actually really appreciate clients who will say to them like, this is what's going on, or like, I know I'm the expert in my body, I know that something is different or something has changed, or I need to be listened to and heard. That's where I would say is empower yourself around your journey. Write down your story, write down what's going on with you. And when you're in with a new doctor, you just need to say that you need to advocate for yourself. That's the biggest thing. Even myself working with doctors as much as I have, I still have to advocate for myself. I still have to go in and be like, I know my body, I know something that's wrong. Like, and if you can't help me, there's got to be someone else out there who will help me. But this is my story, this is my journey, and this is where I'm at. That alone right there feels so empowering to just be able to say, this is, I know me, this is what's going on. And our worth isn't contingent upon someone listening to us, right? Like their opinions don't have to become your truth. Medical doctors try as best that they can, but they really are there to help with symptoms. They're symptomologists and they're diagnosticians. Like that's really what doctors do. And so also looking at it as like, finding the right fit, but also empowering yourself to know your own journey. Some of my greatest clients that I ever worked with, especially in the hospital, they would come in and they would be like, this is what's going on with me, A, B, C, and D. And I'm not deviating from this. I know my body, I know, and they're succinct, they have it all written down, and they have literally done their work on knowing them, but also knowing their journey and being really clear with doctors about it. I would say if there is a doctor who's not willing to sit down and listen to you talk about your journey and your story, they're not the doctor for you. Cut and dry. Doctors and therapists are a dime a dozen, as I tell everybody that works with me. I'm a dime a dozen, but get someone who will listen to you and that you can tell your journey to, and don't feel rushed. There's no reason to be rushed around this. And this is really important, especially with the arthritic community, where it's like so many people have been told like nothing's wrong with you, your immune system's fine, your blood works fine, you're faking it, you just, you're just in pain, or you just want this. That's not the case. And so learn to advocate for yourself and do your own work.
Love that. That's so good. Um, okay, another question that I have, I'm going to lump these two together because they're pretty similar. So one, do you recommend finding a therapist that specializes in autoimmune disorders, chronic pain, or chronic disease, or just finding one that is a right fit for you? And then in tandem with that right fit, do you have any sort of questions that would be good to ask your new therapist to figure out if they are a good fit?
Okay, yeah, good questions. So I would say if you can find someone who specializes in it, I'm going to be honest, as a therapist on Psychology Today, if you were to look me up, you would see that I have a lot of specialties, and I do add kind of chronic and long-term illnesses and life transitions. But therapists really try not to pigeonhole themselves either to say that they are specialized specifically. I think if you look for someone who's specialized in that and you can find them, I think that's wonderful. I think though, if you cannot, It's about interviewing your therapist. It's really something where I actually really value every client who comes to me and really questions me. They'll be like, "Well, what's your experience and what would you do in this situation and how do you address these things?" and are really curious and really kind of forward about what they need from me because it is a relationship in reciprocity. I would hate for Haley to come to me and just listen and then leave and be like, "That was worthless." Like I didn't get anything from that whole section with me and with Morgan because it's about our relationship together where I want her to challenge me. I want her to say like, "Hey Morgan, this doesn't feel good," or "What about this?" or "I need to be heard on this," because I'm also just a human being. And so I think that it's finding a therapist who is going to be willing to listen to your journey, whether or not they're a specialist, but just willing to listen to you and willing to say, "I'm not the expert on you." I say that to Haley all the time. "I'm not the expert in you. You are. You help me help you. And also, I don't know what's going on with your body. So you have to you tell me so I can help you that way." And so again, it's really about that advocacy piece and really having people listen to your journey and empower you and empower yourself.
Yeah, that's really
Oh,
great.
what was the other one? Did I answer the other one?
I think you did. Any
Okay.
questions to ask your new therapist to figure
Oh
out
yeah.
where to fit? Yeah, you could say that. Or
And honestly, don't ever feel bad. If your therapist is offended that you don't want to see them, they're not the therapist for you. I will tell people at the very beginning, if I'm not a good fit, tell me and let me find someone who's a better fit for you because I'm a dime a dozen. I'm easily replaceable, but we better be a good fit together because it is a relationship in reciprocity. So if you go to one session and you're like, "That doesn't feel good, I don't think this is the right fit," it's okay to find someone else.
yeah,
That's okay.
I like that. Can you define the term trauma trigger? Someone asked.
Yeah. Um, so a trigger for trauma is it's so what we've always looked at it is we've looked at it in a PTSD lens where it's like a flashback or like something reminds you of the traumatic incident. What we're looking at now in a broader picture of trauma is how I define a trauma trigger is it really could be anything. It could be like a sunny day and you see the Mel woman, go down the street. It may have nothing to do with your trauma, but a trigger is a physiological response to a memory, right? So in our brain attaches a memory to an emotion, and then our ego holds on to that. So that's how trauma kind of works in our brain is that the trauma happens. So we have the memory of the trauma, and then we have emotion around trauma. And then our ego kind of attaches those two together. And then our ego kind of holds that all together, kind of wrapped up. And so anything can really trigger a traumatic event from the past, right? So when I'm working with my clients, I say it's anxiety is anxiety. Everyone has anxiety and depression. There's no one that I've ever worked with, including myself, who doesn't have anxiety and depression. We're human beings, that's normal. But what's different around a trauma trigger, and I've worked a lot with Haley on this, is it's like a punch in the gut, right? So it's like almost like the wind is knocked out of you. All of a sudden, you have a flood of emotions or memories, or you kind of get stuck in like, "Oh my gosh, what's going on?" Maybe some people will have anxiety or panic attacks around fear. But trauma triggers really can come from anything. It it really is so individualistic. I have clients sometimes who have had severe trauma in the past, and then they'll be like, "Oh, I was walking down the street and a dog barked," and all of a sudden I was automatically like in cycling in my trauma. So I wish I could tell you like there's some really good identifications of what your trauma trigger would be. Really, it's about working with a therapist who is trauma informed. That is one thing that you should always ask a therapist is if they're trauma informed and how are they trauma informed. But it's like Haley's trauma triggers would be completely different from mine, but it's about identifying them that when you do have them, how do you work through the trauma trigger? Triggers are always going to happen. They're never going to go away, but it's actually the work that you do around the trigger that helps you not re-traumatize yourself. That's a really roundabout way. I wish I had a more definitive answer, but that's what I got.
That's great. That's great. As we're finishing up, I've got a couple more questions, but I'm just going to choose because I feel like you've answered a good amount. Let's talk about psych medications and how they can resolve some of the trauma response from the body or just thoughts on medication. I think that a lot of people are hesitant and it kind of can be a tough topic. So
Yeah. So my actual official is a licensed clinical social worker. There is a reason I am a social worker and not a psychologist or a psychiatrist. Social workers, we look more at like person within their environment. We really try to stay away from like labeling and medications. So that is one thing that I'm actually super passionate about, is that I do believe that medications are really important, but I believe that they're 10% of the pie and not 100% of the pie. So I always tell my clients, medication is 10% of the pie, the other 90% is you. I think psychiatric medications, the faces of psychiatric medications are changing. We are finding a lot of different alternative, especially like anti-inflammatory diets, um, herbal medications, vitamin D, some of these other things that are more natural can help with a lot of like the symptoms that people are having with inflammation and depression and, kind of this anxiety piece. Now, when people really do need medication, we are really looking at the heavy hitters. So, an anti anxiety and antidepressant. Those are really the things that we would use for trauma specifically. If someone wasn't able to get up and out of the trauma, then we would use a kind of a smattering of medications to help them with the trauma that's going on and then kind of try to wean them down from that. The one thing that I would say about an antidepressant and with medications around depression is that if your body doesn't naturally make serotonin, there's not any therapy in the world that will help you make serotonin. That is, you have to have a medication to help with that. I think that medications can be very stigmatizing because people are like, oh, well, I'm not crazy or I don't need this medication. A lot of the times I tell my patients, if we are in the middle of like a pretty big crisis or a pretty big traumatic event or something that's really heavy right now, and you just don't feel like you can get up and out of it working with these coping skills, then yeah, get on medications. It's really important that your body doesn't make the chemicals that you need. So you do need medications. So that's where I would say having that honest and genuine conversation around like, if my mental well-being, if I've tried everything, right? Like if I've gone to therapy and I am working out and I am taking care and I'm healthy and I'm doing all this stuff and I still don't feel good, you need medication. And it may just be medication for a short period of time, or it may be medication for a longer period of time because your body doesn't make the chemical that you need. But I think it's about really having that honest conversation that there are side effects to all medications that we take. There are only so many things that we can do without medications, and that's why we have medications. But also knowing that like we're kind of trying to destigmatize the discussion around mental health, but also mental well-being and also medications. And we're finding that, most medications are needed, especially at a really kind of high time, or if your body doesn't make the appropriate chemicals that it needs to feel better. That's just cut and dry.
Awesome. Awesome. Well, thank you everyone for sending in some of your questions. Sorry we couldn't get to all of them. And thank you so much for coming. Overall, I would say therapy has been life-changing for me in managing my chronic illness and just managing my overall mental health and well-being. And so I would highly encourage it. It's been nothing but a positive experience for me. And I would say the biggest key is just finding that good fit of a therapist. So thanks everyone for coming. And Carrie, I will maybe pass the time over to you.